So I wanted to talk about nipple reconstruction. So congratulations on getting to this point. If you had your mastectomy, as you know, you removed the nipple areolar complex with that. And so this is of the 3 operations that we typically do, the first, second, and third stage. It's the easiest of the surgeries, but I think it's arguably the most important. And one of the things that I always tell my patients is that a breast without a nipple is kind of like a face without a nose. And so when you build a nipple, these patients feel whole again. And I think they're surprised at how good they feel after having a nipple. And I think a lot of times they apologize for wanting a nipple reconstruction, but it's a very, very important part of the recovery process. And when you build a nipple, what you're typically doing is you take some skin from either right above the pubic hairline or out on the side of the chest wall. And you use that as a full thickness skin graft. And you put that onto the chest wall, and that becomes your new areolar skin. The nipple itself you create from the mastectomy skin flaps. So you elevate up the flaps, you rotate it on itself, and that actually creates the nipple part of it. And then over the top of that, we put on what is called the bolster dressing. The bolster dressing pushes the skin graft onto the chest wall, and that's in place for about 3 to 5 days after the surgery. And so you'll do your surgery, we see you back in clinic, and then we'll take that off in the office. Once the bolster dressing comes off, I want you to use Aquaphor, and you're gonna put that Aquaphor on the reconstructed nipple and the skin graft 2 times a day for 3 weeks, and then once a day for 3 weeks. And then after that, you're just gonna use a good moisturizer. And as opposed to all the other surgeries where I want you to wear fairly tight compression afterwards, when I do a nipple reconstruction, I don't want you wearing a tight bra that smushes your new nipple because we don't want it pushed off to the side. So a much looser bra after the surgery. And then as far as activity goes, this is again the easiest of the surgeries. You can go about most of your activities after we take that bolster dressing off, as long as you're not wearing anything that's pushing down on the nipple. So when you do the nipple reconstruction, it is not a functional nipple. You won't have sensation, and the nipple does stick out permanently. And when we first do it, we purposely design it so that it sticks out further, and you'll lose about half that projection over time. So that's one of the concerns that women have, is they don't want a hard nipple all the time. And generally over time that will settle down and it'll have a very natural appearance. But again, it's not a functional nipple, and it doesn't change in size or shape.